Nau mai, haere mai. Welcome to this module from the New Zealand Dementia Foundation's Dementia STARs education series. Dementia STARs is a series of 8 modules covering some of the most common topics that caregivers work with every day when supporting people living with dementia. You are an extremely important part of the network of people who work in dementia care, and we hope you find this course very helpful for your work. Lots of us struggle a bit with remembering to drink enough through the day. We get distracted and busy and suddenly realise it's hours since we had a drink and we're very thirsty. For people living with dementia, this can be a lot more challenging.
Tēnā koutou, e tipu aki ao ke murahiku, ko G te whānau, ko Susan toko ingoa, ko tēnei taku mihi ngā tangata whenua o te rohi nei. Ka nui te mihi kia koutou, nō reira tēnā koutou katoa. I'm Susan G and I'm a dementia researcher and educator. I'm also the liaison officer for the New Zealand Dementia Foundation. Thanks for joining us for this Dementia STARS session on dehydration and dementia. Dehydration is when we don't have enough water in our bodies. Now sometimes people lose a lot of fluid suddenly, particularly when they're unwell and they have vomiting and diarrhoea. We can call this acute dehydration. What's more common is that people aren't drinking enough over an extended period of time. We can think of this as chronic dehydration. And this is the type of dehydration we'll be focusing on today. To start us off, let's hear from nurse Mackenzie Ebbett and caregiver Honey Mohan.
Hydration is really important as it's one of the leading causes of delirium, which is acute confusion. It can also be quite life-threatening if not treated, and therefore we need to do everything that we can to keep on top of it. It's also one of the leading causes of hospitalisation in the older adult. The person with dementia is less likely to prompt themselves to have a drink. Therefore, when we're working with people, we need to actively encourage them to have a drink. It's also one of the main reversible things that we can have control of when caring for people with dementia.
So some people with the dementia would not really want to eat food, and they might not drink as well. So as a carer, it's our duty to provide them with food and make them drink any kinds of liquid that they like. And we also have intentional round for liquids and for toileting and see if they are all good. And then we give them liquid for all the 2 hours, like we feel that we have intentional round all 2 hours. So we give them sometimes lemonade, sometimes water, sometimes Milo. It depends on their choices and their preference. So we know that at least they have drank the food, they have had their food. And we always have to note what they had in a daily life. So we make a note, in the morning they had this much, in the afternoon they had this much, and this is what their liquid they drank. So it really makes the other carer as well to know, and as a teamwork it's really important to know about each and every resident. We have a very good communication, so we communicate with each staff. See, if I have tried and it's not working, I tell the other carer, see, for this person I tried but they are not eating or drinking, so the other carer will try. So maybe with the other carer they might, because everybody is different, so maybe they might have something or drink something. So if one carer does not work, then we just tell to other carer. And if nothing is working, we tell our nurse. And our RN is really good lady, and she really comes to us, helps us, and it's really a teamwork. So it's really good to be as a part of the team and working together and making all the residents happy and giving them their choice, their preference. So it really matters. That's really good.
One scenario I can think of where hydration showed how important it was working with a gentleman who looked really unwell and potentially looked like he was going to need transfer to another acute hospital for input. It was also one of the things where he did all sorts of investigations. He had all sorts of blood tests, x-rays, everything you could think under the sun, but really all he needed was to be hydrated.
Today we're going to be covering 3 key messages. don't wait, hydrate, and stick to thick when needed. Our first big message when we're supporting older people living with dementia to stay well hydrated is don't wait. We don't want to wait to hydrate because older people living with dementia are at risk of dehydration. When we don't have enough water in our bodies, a couple of things happen. First, we get thirsty, which prompts us to drink. And second, our kidneys start concentrating urine to conserve fluid, and you might notice that as darker urine. But these mechanisms don't work as well when we get older. As we get older, our thirst signals reduce. This is even more pronounced for people living with dementia. So that's a surprising message. Don't trust thirst. The kidneys are our body's filtration system, and they're also not working as well for older people. So that whole system of concentrating urine to conserve fluid may not kick in as well. So that's another surprising message. Don't trust urine colour or concentration. Now these changes make older people more susceptible to dehydration. What's more, older people also have less water stored in their bodies. So here we have Ruru. When he was 30, his body was made up of about 70% water. Now that he's 80, that's dropped to 50%, even though he weighs about the same as he used to. So at 80, Ruru has about 6 litres less water in his body than he did when he was 30. And because Ruru has less water reserves, it's easier for him to get dehydrated. There are even more factors that increase the risk of dehydration for the people we support. Cognitive changes with dementia may mean that the person forgets to drink, has problems drinking, and has to rely on others. Sometimes people deliberately restrict how much they drink because they think it will help them avoid incontinence accidents. Unfortunately, this can backfire because concentrated urine can stimulate the bladder and make the person need to go to the toilet more urgently. Finally, people may be on medications that make them go to the toilet more often. Now, another reason we can't wait to hydrate is because hydration is so important. Every cell and organ in our body needs water to work well. Good hydration is hugely important for our bodies. If we're dehydrated, we aren't able to maintain our body temperature, and that increases the risk of hypothermia. If we're dehydrated, we may not be able to regulate blood pressure. If our blood pressure is too low, we may experience dizziness and falls. If it's too high, our risk of heart attacks and strokes increase. If we're dehydrated, we can't properly digest food and flush out waste through our liver, kidneys and intestines. That can lead to constipation, to kidney stones, to urinary tract infections and to incontinence. We need to be well hydrated to lubricate our joints and keep our skin healthy. So dehydration can lead to pressure wounds, sore dry skin and joint pain. We also need to be hydrated to keep our brain running at full capacity. Even mild dehydration can make people living with dementia noticeably more confused. And if it's not treated, dehydration can trigger delirium. So dehydration impacts our physical health. Did you know that hydration is also important to maintain our mental health? Research has shown that being well hydrated reduces the risk of anxiety and depression in the long term and improves our mood right now. When people are well hydrated, they're calmer, more content and less tense. They're less confused and tired. Basically, hydration makes us happier. So you may have noticed some of these things if you've ever had the experience of feeling much better after you've had a drink. A non-alcoholic drink, that is. What you were noticing was that you were a little bit dehydrated. So what kind of things might we notice before you had your drink and your fluid levels were back up? You might have noticed that you were passing less urine, that your urine was dark. You might have noticed that you were thirsty, you had dry lips, a dry sticky tongue, a swollen tongue, bad breath, sunken eyes, fragile skin, or that your skin was less elastic. You might have noticed things like having a headache, feeling dizzy, heart palpitations, or low blood pressure. Maybe muscle cramps, sugar cravings, constipation. And as we talked about with your mental health, maybe you felt tired or irritable. You might have been tense, found it hard to concentrate, or felt confused. There are a huge range of dehydration symptoms, and they can vary across people and how severely dehydrated they are. But as you have noticed yourself, dehydration can impact our mood and our well-being. So from our own experience, we know that hydration can make us feel better, and we can do that for the people we support. Hydration is a way we can help people feel better. Another reason why we can't wait to hydrate is because mild dehydration can be harder to spot in people living with dementia, especially older people. So we just talked about some of the signs and symptoms of dehydration that you might notice. If we see those, especially if we see several of them together, we should definitely consider dehydration in an older person. But we shouldn't wait until we see any particular sign to really get on top of hydration. And that's because there is no sign that we can use to tell whether an older person living with dementia is dehydrated. Important research has found that many of our traditional signs and symptoms, including being thirsty and urine colour and concentration, aren't reliable indicators of dehydration in older people. Now, as we've already talked about, some symptoms don't show up even when the person's dehydrated because their body systems aren't working well, like the thirst response and the kidneys. On the other hand, sometimes symptoms occur even when the person's well hydrated because of other health conditions or age-related changes. What this means is that the only reliable diagnostic test for dehydration in older people is a blood test to measure how much water is in the person's bloodstream. That sounds complicated, but if you're concerned about dehydration, as a simple first step, invite the person to drink some fluids and see if they perk up or improve noticeably. This will often happen within 5 to 10 minutes. Does it make things better? If it does, then the person was probably mildly dehydrated. The best way to get the person's hydration levels back in balance is to make sure that they drink plenty of fluids. When they get dehydrated, they can also lose salts and sugars, so eating a little bit of sweet and salty food can help the person to feel better as well. Toast with jam would probably do the trick. Let your team know so that everyone can be extra careful to help prevent dehydration for that person in the future. You may be asked to help keep a record of how much the person is drinking for a few days. So mild dehydration can be dealt with in quite a straightforward way. Let's talk about some more complex situations around dehydration. There are some situations where we're going to want to keep a watch and get some advice from our team. If you've got the person to drink more, but the symptoms still persist, they may have severe dehydration. If someone's unusually, extremely thirsty, that may be a sign of a medical condition. Then we have more urgent situations where we want to ring a nurse or GP. If someone's suddenly much sleepier or much more confused than usual, that may be a delirium, which can be triggered by dehydration. If someone has a rapid, weak heartbeat, or if they haven't passed urine for 8 hours. For moderate to severe dehydration, the person may need to have extra fluid through an IV drip or a subcutaneous infusion. That's where we provide fluid through the skin. They may also need to get their pulse and blood pressure checked. This isn't a long-term solution though. We're still going to be vigilant about helping them to hydrate. So to recap, we don't want to wait to hydrate because older people living with dementia are more at risk of dehydration, because hydration is so important, because mild dehydration can be harder to recognise in older people, and because being even mildly dehydrated makes us feel pretty miserable, and we're happier when we're hydrated. Helping people hydrate can make their day better. It's one of the easiest things you can do to help the person you support feel better. We're always looking for opportunities to hydrate. How much fluid are we thinking of? Generally 6 cups a day. Maybe 8 cups for someone who's larger. When we say 6 cups of water, this actually means a metric measuring cup, which is 250 mils. Often our cups and glasses will actually hold less than that, but every drink counts. Aim for the best you can do. There are some times when we want to be offering more fluids. If the weather's very hot, if the person's unwell and they're feverish or have diarrhea or vomiting, then they'll be losing more fluid than usual. And if the person's active, for example someone who walks a lot, what kind of fluid? Pretty much any fluid, but let's look at a few special cases. Did you know that about 20% of our daily fluid intake comes from our food? We can use that to help boost hydration by offering food that has a high fluid content like soup, jellies, ice cream and fruit. Lots of fruit and some vegetables are over 80% water. Fruit or veggies as finger food is like hydration that comes on a plate. Coffee and caffeinated drinks are a bit of a special case. Generally, caffeinated drinks do help hydration, but the impact of caffeine is complex. On the one hand, for some people, a moderate amount of caffeine can improve mood and alertness. On the other hand, as you may know from personal experience, too much caffeine can increase anxiety, make you need to go to the toilet more, and interrupt your sleep. And just as you might expect, the research confirms that too much caffeine can make some people living with dementia anxious, restless and jittery, make urinary urgency worse, and can also make some people living with dementia sleep poorly and get up more often in the night to go to the toilet. It's often really useful to switch to non-caffeinated drinks from late afternoon to help sleep. If we suspect caffeine is having a negative impact, we need to get to know the person to work out together how much caffeine makes a good day for them. Each individual will be different. Alcoholic drinks are another special case. Alcohol increases the amount of urine, so it's dehydrating. The stronger the drink in terms of the alcohol content, the more dehydrating it is. In fact, dehydration is one of the main causes of hangovers. So alcohol is a negative for hydration. How do we encourage people to hydrate? Well, firstly, as Honey said in the video, it's a big help to get to know each person and what they like to drink. Think about your own preferences. What's your favourite moment for having a drink? What drink do you enjoy most in the morning? What about in the evening? What about hot days? Cold days? That's a lot of choices we're making every day. So we can ask people what they want today. We can get to know their favourites to make sure we have them available. If they can't talk to us about what they want, we can keep an eye out for what they seem to prefer and drink more of. Secondly, we can highlight drinks to make them appealing and noticeable. The sky's the limit here. You can use your creativity. Sometimes we might be able to add a bit of pizzazz and fun to drinks like different fruits and ice in a nice see-through water jug, having a theme, or even a tasting session. We can make sure our hot drinks are hot and our cool drinks are cool. We can think about the words we use. Sometimes it can be more helpful to offer a choice of 2 favourite drinks than to just ask whether they want a drink. It reduces the chance of them saying no. So rather than saying, "Would you like a drink now, Mr. Smith?" we can say, "It's almost time for a lovely cuppa, Mr. Smith. Would you like good old gumboot tea or a nice cosy Milo?" And you can hear that I'm trying to talk up the drink to make it sound really appealing. We can also think about the cups and glasses we use. Do they have a favourite? If they do, let's make sure we use that. If they don't have a firm favourite, what catches their attention? A high contrast colour for the mug, like bright red, can encourage them to drink more. A clear glass for cold drinks can help them see how much they have left. Being social can be a secret weapon. People drink more when other people are drinking. Sometimes, if you can manage to sit and have a cuppa and a chat, that will be the best thing all day for encouraging that person to drink. We can also do a bit of problem solving. Some people can't manage a whole drink at a time, so we can think of little and often and encourage a few sips at a time really frequently. Some people may need special adaptive drinking equipment to make it easier. You might also remember that we mentioned that for some people, drinks aren't appealing because they're worried about incontinence. We can provide reassurance, but we also need to back that up with being proactive about toileting. And for all these things, whenever we find something that works for that person, we want to write it in the care plan so that everyone knows. Another handy hint is that we can make sure that we have a routine for offering drinks. People living with dementia are often perkier in the mornings. If you're supporting a person in the morning, that's a great time to encourage more fluids. If we can manage it, we want to encourage a litre of fluids in the morning. Then we've got a great chance to have a well-hydrated day. So the person could have a drink before and after getting ready for the day, a drink with breakfast, milk with their breakfast cereal, and a whole glass of water with their medication. You could even try encouraging them to take each pill separately. That means more water. Then we have our routine for offering 1 or 2 drinks with every meal and snack. Morning tea, lunch, afternoon tea, tea time, and in the evening. Having a drink about half an hour before a meal can actually also help digestion and appetite. Now, on top of that, we want to make sure that drinks are available in their line of sight anytime they want one. Okay, so we're now at the third and final part of the session, which we've titled Stick to Thick if Needed. In some situations, thickened drinks are really useful. Thin fluids travel through our mouth and down our throats quickly. For people with swallowing difficulties, it may be too quickly, and the liquid ends up going down the wrong way. It ends up in the lungs, which is called aspiration. Now, needless to say, our lungs are not designed to have food or liquid in them, so aspiration can cause aspiration pneumonia. Thickened fluids slow this down. They can help the swallowing muscles to keep up with the fluid. We only use thickened fluids if the person's been assessed by a health professional as needing it, but once that happens, we stick to thick. Ashley Farr, who's a speech-language therapist, is going to talk us through thickened fluids for when someone has a swallowing difficulty.
Dysphagia is the medical term for a swallowing impairment, and dysphagia presents in up to 57% of people with dementia. Dysphagia and dementia can occur at any time in someone's dementia journey, depending on their type of dementia, the symptoms of their dementia, other medical comorbidities. However, often the prevalence of a dysphagia increases as dementia severity increases. The most common safety risk people think about with regards to dysphagia or swallowing is aspiration. That's food or fluid going down the wrong way into the lungs instead of into the stomach. The way we often suspect aspiration when watching someone eating or drinking is that they're coughing or choking during or immediately after meals. Aspiration can cause choking episodes, can result in aspiration pneumonia, or can increase the risk of dehydration or malnutrition because the food or fluids aren't ending up in the stomach where they're supposed to be. All of these can result in significant illness and can sometimes be fatal. Not only can coughing or choking with oral intake be a sign of aspiration, sometimes people might show other signs, such as sounding really gurgly during or after eating and drinking, spiking their temperature often, or developing a chest infection or really chesty cough. For most people, regular or thin fluids, as we often call them, is what they will take, and this should always be where we start. So unless someone is showing consistent signs of dysphagia or aspiration, or you receive instruction that they should be taking a thickened fluid, there's no need to worry too much about the thickness. These people can take whichever fluids they like, be it water, carbonated drinks, or perhaps a thicker smoothie. In some situations though, when a person has dysphagia, we may need to thicken their fluids. This involves adding a special thickener to their fluids to make them one of 3 different consistencies: mildly thick, moderately thick, or extremely thick fluids. Speech-language therapists may prescribe thickened fluids for people who are having greater difficulty swallowing or at higher risk of aspiration with regular fluids. Thickened fluids essentially move more slowly through the throat, sometimes increasing control of the fluid in the mouth and the throat, allowing for more efficient swallowing and greater time for the person to close their airway before the fluids move past the airway. It's important to remember that thickened fluids are not always safer. In fact, if someone aspirates a thickened fluid, they're at higher risk of more negative outcomes, such as an aspiration pneumonia, than if they aspirated regular fluids. So this is something as speech therapists we need to keep in mind. If you're concerned that your client might be aspirating thickened fluids, it's important to seek a speech-language therapy referral for a swallowing review. With regards to thickened fluids, the viscosity or thickness of the fluids is really important. We use the 3 different thickness levels to assess a person's swallow and their aspiration risk. For many people, one thickness level might be safe, but another might result in aspiration or greater residues in the throat after the swallow. As a result, it's vitally important that these thickness levels are replicated in real life. If it is recommended that someone takes moderately thick fluids, we need to be certain they are thickening that to that level, because there is a chance they will aspirate anything thinner, and anything thicker may result in other problems.
As Ashley said, there's an international system for labelling how thick fluids are. So let's cover the main ones that you'll be meeting. Level 2 is mildly thick. This is a bit thicker than water, but it's still easy to drink from a cup. So you can think of some fruit drinks like apricot nectar or V8 vegetable juice, or maybe some cream soups. Now, we could even suck this kind of a fluid up through a normal straw with a bit of effort. That typically wouldn't be a great idea for the people we support though. If we tip it from a spoon, it pours. Now, level 3 is moderately thick. So we're thinking of things like runny honey or golden syrup or pouring custard. We could use a cup, but it's usually easier with a spoon. If we tip the spoon or the fork, it drips or drizzles in strands. Level 4 is extremely thick, like instant pudding or Greek yogurt. It holds its shape on the spoon. If we put it on a fork, it pretty much holds its shape as well. A bit might sink through the gaps, but wouldn't drip. And if we tip a spoon, it stays together as a dollop. There are some fluids and foods that can be a bit of a surprise. So let's play a quick game of Thick or Trick as a way to find out about some of these surprises.
Welcome to the Thick or Trick game. I'm going to show you 2 foods. One of these pictures will probably be okay for someone who needs thickened fluids. It will be the thick choice or the safe choice. But the other one will be a food that we should avoid. So that will be the trick choice or unsafe choice. Your job is to spot the trick, which one isn't suitable for someone on a thickened fluid diet. Which is the trick? Ice cream or mousse? The answer, ice cream. If it melts, it's a trick. Ice cream melts in your mouth and becomes a thin liquid. So we need to avoid ordinary frozen treats. Which is the trick? Grapes or thick yogurt? The answer, grapes. If it releases liquid, it's a trick. Remember how we said that juicy fruit can be a great source of fluid? Unfortunately, juice is a thin fluid, so fruit like grapes, oranges or watermelon are a trick. Which is the trick? Porridge or cereal? Answer: cereal. Mixed textures are a trick. The milk is a thin fluid. Some soups can be like this, like minestrone or chicken noodle soup. Even though they have filling bits in them, the soup base is a thin fluid. Which is the trick? Puree or jelly? Answer: jelly. The thickener for jelly is gelatin, and gelatin is a trick. Jelly melts in the mouth and becomes a thin fluid.
Excellent. So that's some tricks to look out for when we're sticking to thick. Encouraging people to keep hydrated can be particularly challenging with thickened drinks because they're just not as nice. So how can we get creative with some thickened fluids to help make them more pleasant? Now, first of all, we can try flavour. Plain water is the worst for thickened fluids. Can we add some pretty obvious flavour? We can try out different drinks and see what works for the person. We can thicken pretty much anything. The second thing is temperature. Room temperature is pretty horrid for any drink. We still want our hot drinks reasonably hot and our cold drinks cold. Being different from body temperature is actually a cue that there's something in your mouth, and that helps swallowing. If we're making tea or coffee, we do want to add the milk before we add the thickener so we don't dilute the drink. Sometimes a pre-made thickened vanilla nutritional drink can be warmed up and we can add coffee or Milo powder to make quite a nice hot drink. Now, one thing you do need to be aware of is that if you add a thickener to a hot drink, it will typically get even thicker as it cools. So that can be really off-putting to have a super thick cold cuppa. If we're making a cold drink, remember that we can't use ordinary ice cubes because they'll melt to a thin fluid. So we can, pre-chill our fluid in the fridge before we add the thickener. You could also try ice cubes made from a thickened liquid that melt to a thickened liquid. Not all thickeners will work with this, but apparently Easy Thick Advanced and Nutilis do. Okay, so our third tip is reframe. If we're used to having a particular drink, but now it's different because it's thick, well, that can be disappointing. Sometimes we can reframe the drink to make it something that we'd expect to be thick anyway, like a smoothie or a milkshake or an eggnog. If you're willing to go that extra mile, you can find recipes for smoothies and other thick drinks that are really appealing. Sometimes eating food, especially food that's a bit sweet, may be more appealing than drinking a thickened fluid, even though they may actually be the same texture. So hopefully with some trial and effort and creativity, we can encourage everyone, even those on thickened fluids, to be well hydrated. So, are you ready for a drink now? We've covered a lot, haven't we? And it's great to know that you'll be heading out to make a positive difference to the day of the people you support. So, don't wait, hydrate. And when people have been assessed as having swallow issues, we know how to stick to thick. That completes this Dementia STARs hydration module. It's been an absolute pleasure to share this with you, and I hope that you will find time to check out the other Dementia STARs topics. Ngā mihi nui.
We hope you have found this Dementia STARs course valuable. We really appreciate the time you have taken to allow us to share some new ideas and fresh perspectives on this important topic with you. We hope you will return to your work with people living with dementia with renewed enthusiasm. It's such an important job, and you are a very precious part of the dementia family. The New Zealand Dementia Foundation would like to thank CHT Healthcare Trust for their generous support of this project. If you would like to learn more about the New Zealand Dementia Foundation's work, check out their website and join the community. This module is one of a series of Dementia STARs courses. You can find out more about the other topics from your workplace educator or on the New Zealand Dementia Foundation's website. Ngā mihi mai oha. Thank you so much for your commitment to people living with dementia.